Välkomna till nästa del i programmet. Det ska handla om hur ser den digitala utvecklingen ut inom vård och omsorg ute i Europa. I panelen så samordnare vid samordningskansliet för Vision e-hälsa 2025, Carina Tellinger McNeil. And please welcome Henrique Martin. Okay.
Thank you so much.
Thank you.
Welcome, Professor Henrique Martin, to Gothenburg and to this 2025 podcast. You are a doctor and active at the Minister of Health in Portugal. You have also a long experience of digitalization issues in Europe. And I was thinking this talk that we should talk about future healthcare and social care in Europe.
Yeah.
And with your help, we would like to describe some of the current, well, I would say, trends.
Yeah, well, I think one of the current trends is definitely that all around Europe we're looking at the cost of healthcare with severe concern. Poorer countries and smaller countries like Portugal is because basically we can't afford it. And I think even the more rich countries, they have to look at this in depth because definitely the costs are rising too high. And that is common. I think that is common. You see ministers of health talking about joint procurement of drugs, and you will see them talking about IT more and more. They are already talking about it slowly, but you'll see more of that.
So you feel that there is a consensus among the European countries that digital technology is an important prerequisite for being able to give, in the future, good healthcare?
Well, I think yes. I think many countries have conviction that they need to do something to change. I'm not so sure that all ministers are equally looking at IT as the critical enabler.
All right.
And I think you have to see it like that. Otherwise, I wouldn't be in my job. But basically, one thing is, okay, we need better training, you need better facilities, more efficient facilities. You can't stay with 100-year-old hospitals just because they look old and nice. But this is different from saying, no, there's no other way except IT as a big leverage for change in terms of the provision of care.
All right. So would you say that the European countries is about at the same level when it comes to digitalization in healthcare, or are there sort of big differences between the countries?
Well, if you're talking about taking a picture with your phone and making it digital, I think we're all alike, but everything else is different. So basically, I think, you know, I'm not going to point any country, but there is easily a 10 to 15-year gap between certain countries and others. I mean, there's countries where even the concept of e-prescription is alien to these doctors, to these professionals, to the patients. Whereas in other countries, e-prescription is no longer a topic, it's something you've done already.
Yeah.
And you're now looking at intelligent prescription, mobile prescription, and integrating drug prescription with, for example, as we've done in Portugal, prescription of physical exercise, prescription of apps. So, I mean, definitely, this is one example. But if you go to the screening in terms of vaccination records, there was a recent study by the European Centre of Disease Control, which is actually here in Sweden. And, you know, some countries, they don't have a database of their vaccinated population, whereas others have a database and they are supplying vaccination bulletins online and on the phone to their citizens.
In Sweden, there is an ambition that rather than to have to visit a health clinic or hospital, you should be able to give care and support more at home, so you can stay at home more and sort of treat yourself there. And the important group for this is elderly, but also people with chronic diseases. Is the same thing happening in the rest of Europe? Is that some kind of trend that you see there too?
Well, I think countries are trying to move from telehealth pilots and telemedicine enthusiasts to what I call institutionalized telehealth. I mean, certainly I can speak for our country. we have had an era, I call it like that, of 20 years, where there was the occasional enthusiastic doctor doing this, doing that. There was the occasional pilot. And now we have specific funding process for tele-appointments. We have a national platform. We have a national center for telehealth to share good practices, guidelines. And we are looking at, for example, elderly care. We have launched a new initiative which is a hybrid between phone care and primary care, where we, based on demographics and profile, we identify elderly folks at risk, isolated elderly people. Then we call them to make sure they are on that risk. And then we decide, okay, this guy we can care by calling. This guy we have to refer back to primary care. So I think we are seeing an interest of moving from experimentation, regional, local experimentation level, to national institutionalized projects.
All right. Sweden has one of the lowest amount of hospital beds per capita, and we also spend the shortest time in those beds, according to the latest OECD report. Is there a risk that patient safety will be affected when more and more care is provided in the patient's home rather in the hospital?
Well, I think as long as they don't sleep on the floor of the Swedish hospitals, I think you're doing good in reducing the number of beds.
Yeah.
The question you raise is a good one, and I personally, I'm an internist, and at least back home in Portugal, many of our elderly people, they came to the hospital not so much because of the clinical condition, but because their house was not prepared for their clinical condition. Oh. So I think you have to think that sending people home is not the end of the responsibility for healthcare. You may need to send someone there to fix some parts of the home if you really want to make it safe. So it is undoubtedly cheaper, however. Yeah. So it is cheaper to go to the patient's home. And I'll give you an example. In Portugal, a hospital stay one night, 450 euros, right? I presume in Sweden it's much more expensive, and it's in kronas. But anyway, with 450 euros, you can pretty much, change the kitchens, things, and you need to invest that. So my answer is yes, if we accept that households are our new hospitals, and they are a sort of a mini extension, advanced extensions of hospitals, but not just throw the patient out into the home and then expect him not to return.
Okay. You are the president of the European Union's e-health network, and you work, among other things, to facilitate the increasing exchange of information between the different European countries. According to what I understand, the most important initiative in Europe is patient overview, exchanging that, but also exchanging electronic prescription.
Yeah.
And in January this year, the beginning of European e-prescription sort of transmission started with Finland and Estonia.
Yeah.
So what is the next stage, and will the other countries join this?
Yeah, so this is a progressive project. It's called waved approach. Every year is a wave. Finland and Estonia were the first ones. They are exchanging an average of 17 prescriptions per day, which when you look at the beginning, I think is a good number. We have had already approvals for Czech Republic and Luxembourg to receive patient summary, as you call it, patient overview. Patient summary is the name we use, but we haven't had any country as a sender of patient summaries, except last week Portugal had been approved for the 4 services.
Okay.
So we should be live in the end of June, in beginning of July, with both receiving and sending of patient summaries, as well as receiving and sending of e-prescriptions. So theoretically, if a Portuguese has money enough to travel to Czech Republic, and some of them do, their patient summary will be readable in Luxembourg and in Czech Republic for starters. Give you an quote, maybe you don't know, but 19% of Luxembourg population is actually Portuguese.
All right.
Okay, so every year there are thousands of Portuguese traveling back from Luxembourg to Portugal in the summer to visit their family and then back home to work. So we are building something that, for example, for Portugal, means to keep 3 million Portuguese living outside Portugal connected to their GPs, because they don't lose their GP position when they are working around Europe, and that's very important.
European e-prescriptions and patient summary, as you said, described as a key initiative in terms of free movement, which is one of the EU's core principles. However, is this the right priority when you think about the aging population and so on? Shouldn't we spend money on that rather than these free movement sort of services?
Well, I think that criticism is fair. And that's why last year, when the Commission communication on electronic healthcare record exchange format came out, this was April last year, we started working, the member states that are participating in the joint action called eHealth Action, where Sweden is included, of course. We started talking with the Commission, and we said, you know what, the next cases have to be cases that are much more provider level, hospital provider level, primary care provider level. So then we went through discussion, debate, and we finally came to the 3 new domains: lab sharing, image sharing, and hospital discharge. So if you look at these use cases, they are very helpful in chronic patients, and they are very helpful in elderly folks. Because if you look at who is consuming most of our resources for labs and for image, you will find that apart from oncology patients that are normally younger, most of this is elderly people. So I think we are addressing now more the sort of intramural exchange, the inter-regional exchange, as well as we are tackling the inter-country exchange. And therefore I think we are approaching the need more than we were before.
Okay. A final question. What is the single most important investment you need to make in order to ensure good healthcare for all EU citizens in the future? What would you say?
I think, you know, I am biased because I'm a professor, okay, at the university. And I teach management in one university and I teach medicine in another. I think the single most important investment is education. We have to change radically, it's not significantly, it's radically, the curricula of hospital managers, middle managers, and then also doctors, nurses, and so on. If you don't change that, you can put the technology in front of them, you can have the beautiful hospitals, the best buildings in the world, they will operate under their preconceived models. And it's a way, you know, it re-emphasizes, you know, you're 5 years in the medical school, then you are 7 years in the specialty training. If you don't have radical innovation in how you are training them, literally, as Plato once said, you know, you have to take the children away from their parents, teach them something new, and then introduce them back. And this is a little bit what you need to do. So maybe you need to have a sort of E or I for innovation, health sort of master course for everyone, or compulsory innovation course, compulsory for everyone.
Okay.
Last 6 months of the course, everyone. And everyone together. So if people don't sit side by side, doctors, nurses, technologists, I don't think you'll make it.
Well, thank you so much,
That's
Dr.
okay.
Amantan, to giving us this sort of European outlook. Thank you so much.
Thank you very much. Thank you very much.
You.
Thank you.